what you're going to notice is when we're all done, our jig is still going to be intact. It's not going to be torn up like alginate would have been, and we can use it for a multitude of things. Suppose we wanted to make a clear duplicate or a radiolucent duplicate for implant placement. This is the perfect thing to use because it's a replica of the approved provisional denture, and it has defined for us where the teeth need to go. So if we need to have a scan guide for a CT scan for implant placement, there it is. We make the scan guide right here. The other thing we can do is we can just mix up clear acrylic, close it down, no spacer, no nothing, and then use that as a guide for our implant placements based on a radiograph and the shape of the ridge. Let me show you exactly how it works. I'm just going to mix some clear acrylic. This is splint acrylic or ortho clear. We're going to mix it to a pour consistency. That's P-O-U-R, not P-O-O-R. I'll tell you what I'm going to do is I'm probably not even going to use a monojet syringe for this. I'm just going to let it leak right into the teeth. If we were making a radiographic guide, a scan guide, we would incorporate a radiopaque material into this, and we would use a different amount of barium sulfate in the teeth than we would in the other areas. I'm going to close this down. Once again, I'm hoping for a little excess. Now this is the same jig that we would have made our duplicate denture in. Now we're going to use for a clear duplicate. Hey, let me show you something else you can do with a clear duplicate. Now this is cool. Suppose you had a patient that you wanted to make a new denture for. They lost their denture, they broke their denture, or some teeth have broken, or they've worn out. An easy way to make a new denture for a patient is to make a clear duplicate of their existing denture or their old denture. Then take that clear duplicate, make a little wash reline with rubber base or some other impression material, take an opposing model of their lower denture, mount that on a box beading port, mount it on an articulator, send it to the lab, and ask them to make you a new denture. That's an easy way. You have a custom tray with teeth on it. It's an easy way to make a new denture for a patient. And then you can pass the cost savings on to them because that's going to cost less than starting completely over again. Typically, we're only going to charge about $1,500 for that new denture. The lab then just makes indices, sets some teeth, and sends you back a final denture. You could run it through hydrocast if you wanted to, but in most instances we don't have to because we reline the clear duplicate. Kathy, could you hand me Miss Patel's clear duplicate? I'm going to drop this in the pressure pot. I'm going to show you a clear duplicate. You got her jig too. This is a patient that we had approved provisional denture. This is her jig, and we made her denture and we used hydrocast. You can see the hydrocast is still stuck on here a little bit. Here is her clear duplicate. Ms. Patel, we had made an immediate denture. When she first came to me, she had 32 teeth. And we had to extract every tooth in her mouth. She had 0 bone around her teeth. In fact, we extracted one of them when we made the initial impressions. It's always a fun day. As we went through the process of making her a denture, she really did not like wearing a denture. The alternative was to have some implants placed and make an implant-supported prosthesis instead of a tissue-supported prosthesis. She asked me, could we do it? Well, I had her duplicate denture, and I had an approved provisional denture, and we were finalizing. So what I did was I made a clear duplicate of her approved provisional denture. Fits on the jig just like this. And then, using the putty, we determined where we would like to place our implants with a very highly technical piece of equipment. This is called coat hanger wire in Georgia. I'm now using some bone sounding techniques, and these know where I need to go to place my implants. I know the thickness of the tissue by doing bone sounding, just like I learned from Frank Spears when your patient has teeth. I now know the inclination of the implants. Can I get them straight? Am I going to have to use an implant that's off-center? The other thing I can do is I can now take this clear duplicate denture to Miss Patel's mouth when I'm ready to place my implants, and my pilot hole that I'm going to drill for my implants, I will use the clear duplicate to punch the original hole. It will give me the exact inclination because we have the bite blocks. The other thing you'll notice is on the putty where the implant can go after I've taken the clear off. This is excellent. I'm going to pull out the clear duplicate that we made for Mr. Bothy. And as I showed you mixing the clear, it's going to look almost exactly the same as the duplicate in pink and tooth colored. So there's our clear duplicate. We would use this, as I said, if we wanted to make him a new denture based off of his old denture, we could wash reline this. Or if we wanted to place a couple of implants in the position of the bicuspids or in the canine area based on other information, this would serve as a great guide. The periodontist that I work with that places implants really loves having these because even if he has a surgical site exposed, even if he's got an area flapped, this will fit into the mouth. If you would just provide a suck down matrix to the periodontist, to whoever you were working with, it would not fit in the mouth because it wouldn't have any stops. And so this is a great device to give to your referring dentist or your periodontist that you work with to use as an implant guide. There again, we can also put different contrast medium mixed into the acrylic to serve as a scan guide, just as we discussed. What this does is it preserves the tooth position, the flanges, and the intaglia and the external surface of the approved provisional denture for the lab. You can see the excess is just a little flash around the edge, and we got a little bubble right there in the palate. If we're going to do a wash reline, we can fill that in with impression material. If not, we can put a little clear acrylic in it, put it back in the jig, and just fill it in the jig. The other nice thing about this is if we want to use this as a positioner for implants, if we want to put an implant in the position of number 12 and number 5 and number 10 and number 7, we can drill a hole, and if we're referring this to a periodontist or oral surgeon to place these implants, they can use this as a jig or an implant positioning guide. The other thing we could have done here is we could have mixed in some radiopaic materials to serve as a scan guide. We would put 1% in the teeth and a separate percentage in the basal seat so that they could then scan that and use it in some of the scanning softwares to determine implant placement. This is really a great tool to have, and I was just making this to show you how to do it. Let me show you how to trim just like we would have been trimming the duplicate denture, and these two are virtually exactly the same. So I'm going to use a large acrylic burr. This is a Brasseler E-cutter burr, and you'll see how fast I'll be able to take off this excess. The little flash is on the edge. I'll just take it down very quickly. The nice thing about having this as a surgical guide is that even if they have the tissue elevated or flapped, when they put this in the mouth, it will fit over the soft tissues in the areas that are not flapped. Surgeons I work with love having this clear duplicate because it provides for them so much information. Now, sometimes you'll get a little lip on the posterior aspect. I'm just going to trim that right off of there because you don't want that to keep the denture from going down in a patient's mouth. In the duplicate, you can actually see the junction of the hydrocast when it was in the approved provisional denture. And the hydrocast came right over right there. You can see the junction of the hydrocast on this side. You can trim that away like we did in the duplicate denture, but there's no need to really trim it away here. One of the things I want to show you about our lathe and the way we keep things clean and sanitary, notice I'm not going to use the term sterile, but we use these little paper containers that you get from the restaurant supply. And we have a little bit of pumice already measured out and stuck in there, and then we run our linen wheels through the autoclave, and then when we get ready to polish something, I just grab one of these. It has a clean linen wheel. It's got clean pumice. I put it down into my lathe, and we have a little water container that I can wet my pumice with. I'll wet my rag wheel, and then we'll put that rag wheel on, and now I have the confidence to know that my pumice is clean, my rag wheel is sterile, and if I'm going to polish a patient's denture that's been in their mouth, I'm not going to take another patient's denture and come polish it on the same wheel with the same pumice. That would be a cross-contamination problem. So this is an easy way to have some little disposable change-out pumice holders in your lathe. First one I'm going to polish is the clear duplicate. You'll notice I'm going to put a little pumice on here. I'm going to polish the labial surface and the borders. I've got my wheel turning this way against or with my border, so if I did it the other way, it would grind back my border. This way, it's just going to feather it down. I'm going to keep some pumice on there. I'll work my way around the side. Notice I got to rest on my lathe or my countertop. Don't stay on any one position very long. You notice I'm staying off the occlusal surfaces of the teeth. The reason for that is you don't want to heat this acrylic up. I want those borders nice and smooth. We have everything right here by the sink, so I can just rinse it off real quick. Then we have a little dry wheel that we put a little bit of Maldent or acrylic polishing, or you can use my all-time favorite, Fabulosta. I should do a commercial for some of these companies. Fabulosta. I prefer the Maldent. Puts a nice little shine. Sometimes when I'm polishing, I'll drop back and slow the lathe down just a little bit. You don't want to use a wet wheel for this procedure, you want a dry wheel, smoothing it up so it's comfortable if we use it in a patient's mouth. Rinse it off again, scrub it with a brush, dry it a little bit, and as you can see now, we've got a polished, smooth, clear duplicate that can be used for many different tasks in the process.